mong ka 2026 a re tlela batho ba 10 ka number tse tje gore ntwe re boneng ka jeko ya ba times 10 o molomong a re tlele 10 fela ra dominate di masipala tsa rona ra hlokomela batho ba rona ra kore ra ba tsietsa batho bana ba people with disability le ba bang ba sa kuling mare re ba fe di services.
Kanimambo Doers, I am back with the chairperson of people living with HIV. Dua, what do you have to say?
Yeah, as people living with HIV, we attended this event to launch our sector, and the reason why we were here to launch our sector is for us to start to advocate for the rights and responsibilities of people living with HIV. We have Vision 2030. By 2030, we want to see HIV-free generation. Why am I saying HIV-free generation? We have a broken health system in South Africa. Now that system, it's a red tape for people living with HIV to can access treatment. So for them to access treatment, it will assist us to reach the vision. So what we want to see happening is we want to start a program called treatment literacy, whereby we will be training or we will be educating people living with HIV to can adhere to their treatment. If they take their treatment as prescribed, the virus that is within their system is not going to be able to move from their system going out and infect other people. And if the virus cannot go and infect other people, that simply means we won't have the new infections. And if we don't have the new infections, those who are HIV positive, the number, if it's 1,000, will remain with that 1,000. We won't have new numbers that are HIV positive and so on. And moreover, in our health system, we have a challenge of people going to the facilities that are forever full. When you go to the health systems, you realize that within that particular health system, long queues, there is a shortage of staff, lack of medication. In some instances, when you go there, instead of giving you 3 months supply of medication, they give you one. And just imagine every month when you need to go to the facility to go and collect. A program called CCMTT, it has been designed to try and eliminate or reduce the number of visits that you are going to the system. So we still have nurses who are going out to frustrate the program. Instead of giving people 6 months medication, even if you qualify for CCMTT, you don't get that particular medication. So this program here, we are unlocking those challenges that I've mentioned earlier on, that from here where we are, we want to make sure that we are moving forward, educate our community, encourage people to know their status, because we can't be saying we have 8.5 million people. The 8.5 we are talking about is the 8.5 that has tested. Now, how many people hasn't tested in their life? So we really want to encourage people to know their status. If me now, I'm saying I've been living with the virus for the past 25 years. So today I'm healthy, and even if I don't inform you about my status, you won't see even I'm HIV positive. But what I'm trying to say is let us know the status. Go and test. If your results are positive, you must think of Doers Ndlovu. Doers Ndlovu has been living with the virus for 25. If he survived for the past 25, it's possible for me to can survive and take it from there.
Okay, thank you, Dua. But what would you like to say to UAT?
Yes, I'd like to thank UAT for creating this particular platform. Just imagine we are the first political organization to can launch or a program that is talking to HIV. In most of political organizations, even other institutions or churches and so, they don't even talk about HIV. So UAT has created an environment for us to be conducive so that freely within the organization we can discuss, we can encourage, we can educate about HIV. I thank UAT for giving us that opportunity.
Kanimambo Dua.
Let's get it right.